Good afternoon, everyone, and thank you for being here today for this important announcement on the Diagnostic and Surgical Recovery Task Force. We acknowledge that here in Manitoba, we gather on the ancestral lands of the Ojibwe, the Cree, the Oji-Cree, Dakota, Dene, and Inuit, and on the homeland of the Métis Nation. We respect the treaties and agreements that were made on these lands and remain committed to working in partnership with First Nations, Inuit, and the Métis Nation in the spirit of reconciliation and collaboration. I'm joined here today by Dr. Peter MacDonald and Matthew Lister, and I also want to acknowledge Drs. Ed Buchel, Dr. Chris Christodoulou, and Dr. Amin Kabani, as well as Ian Shaw, have joined me to my right, your left. Dr. Peter MacDonald is the Chief Innovation and Research Officer at the Pan Am Clinic and the head section of orthopedic surgery for the Max Rady College of Medicine. Dr. MacDonald will be heading up the Task Force Steering Committee. Matthew Lister is a Task Force Project Team Director. He brings a wealth of health system knowledge and expertise to this critical role. Dr. Ed Buchel is the Provincial Clinical Specialty Lead for Surgery, and Dr. Chris Christodoulou is the Provincial Clinical Specialty Lead for Anesthesia, and Dr. Amin Kabani is the Provincial Clinical Specialty Lead for Laboratory Medicine. Dr. Buchel, Dr. Christodoulou, and Dr. Kabani are members of the Task Force Steering Committee. I want to thank all of these individuals for their leadership, expertise, and guidance as we embark on an important initiative for Manitobans who have been waiting for diagnostic and surgical care. COVID-19 has had a profound impact on all of our lives, including those who work in the healthcare system and the citizens who rely on our health system for diagnostic services, treatment, and care. We know that the demands created by the pandemic have resulted in backlogs and wait lists in non-COVID care. This includes people waiting for a surgery or a diagnostic procedure or other types of care. I know that these stories of delayed care touch each and every one of us. They are frightening for us and our loved ones. I also know there are also stories of good work done by our healthcare providers to address the impacts of the pandemic on diagnostic and surgical care right here in Manitoba. And here are some examples. We know that some of our hospitals have had to redeploy their staff to provide COVID care. As a result, some of our hospitals have not been able to provide their pre-pandemic baseline level of surgical activity. That is why in the summer of 2020, work was undertaken to begin to address the backlog of surgical and echocardiography services through requests for supply arrangements. We also refer to them as RFSAs. This process of RFSAs was initiated in the summer of 2020. The RFSA process allowed us to perform 5,500 procedures at other locations like Cancer Care Manitoba, Western Surgery Centre, Pan Am Clinic, and Vision Group. These additional procedures included over 3,000 cataracts, 1,900 echocardiograms, over 250 foot and hand procedures, and several other types of surgical procedures. In the current fiscal year, the RFSA process is contracted to bring more than 9,000 additional procedures to our citizens that are waiting for care. These include more than 4,600 cataracts, over 600 foot and hand procedures, and over 600 pediatric dental surgeries. COVID is an unprecedented foe, and outbreaks can always jeopardize our plans. However, having this additional surgical activity distributed to multiple providers away from the hospital inpatient setting can help us to manage the risk that a COVID outbreak has on surgical and diagnostic activity that takes place in our major hospitals. Another successful example of taking innovative action is the outpatient ultrasound clinic that Shared Health Diagnostic Services has established at a clinic located on Pembina Highway. Dedicated ultrasound techs have shifted from their original work location at hospitals to divide their work between their regular work location and this clinic. By having this standalone clinic, patients have been able to come to the clinic just in time for their ultrasound. They haven't had to worry about waiting in a hospital waiting room or having a hospital outbreak cause their appointment to be cancelled. This is an example of the innovative ideas that our providers have been creating over the past year. Shared Health has advised me that ultrasound wait times are now below the pre-COVID levels. Another excellent innovation is in echocardiography. Wait times for elective echocardiograms have been very long in Manitoba, exceeding national targets for many, many years. After COVID-19 Wave 1 in June of 2020, there were 7,279 echoes in the queue, and wait times were 45.3 weeks. Since last spring, so July 2020 to June of 2021, Shared Health Diagnostics completed 26,958 echoes, and the RFSA performed another 2,690 echocardiograms. By the end of June 30th, 2021, wait times had been reduced by more than 36 weeks to 7 weeks, and the wait list had dropped by 68%. This was accomplished in part by hiring the Red River graduating class of echocardiography students. In echo, we are not finished yet, but this is an example of what our system can achieve when we focus on innovative solutions for our challenges. Another example is in diagnostics targeted burst of activity, which also allows us to address waits. So, for example, in May of this year, a time-limited targeted effort allowed Shared Health to perform an additional 1,400 extra CT scans in May. While these achievements are important and worth celebrating, we know that COVID protocols lengthen the cleaning time in MRIs and operating rooms. So it isn't even always possible to get back to pre-COVID activity levels at the same sites. That is why we need to seek more solutions to help us manage these challenges that we face. Cancer Care Manitoba advised me that during the pandemic, cancer services have been protected and prioritized to the greatest extent possible in our province. That is a testament to the planning and collaboration between the provincial surgery program under the leadership of Dr. Ed Buchel, and all cancer surgery sites as well in Manitoba. While there were dips in many cancer screening, diagnostic and surgical activities in March to June of 2020, focused attention has protected cancer activity and helped to get these on track. Cancer Care Manitoba has advised me that we are on track for known backlogs to be addressed within 2022. Saving that, I caution that we need to keep vigilant about deferred care. It's the part of the backlog that may not even yet be known to our health system. So in other words, there may still be outstanding annual physical and late-stage diagnoses that may emerge over the next year. The importance of cancer screening and early diagnosis remains as important as ever. So while much good progress has been achieved as a health system, we know that there's still much work to do, because we know that issue of deferred care will emerge as we look after our pandemic. We're currently in discussions with a provider of spine surgery to access more surgical capacity, and we're exploring even more options to access care in new and innovative ways. We need to find solutions that make progress, and we will do that together. We have a 5-point plan to address the diagnostic and surgical recovery. First, improve the capacity of the existing provincial system to deliver activity. So, for example, Health Sciences Centre in Winnipeg has started to introduce licensed practical nurses into their operating room workforce. It is safe to move this different model of care and make this change, which will help reduce reliance on registered nurses to provide all operating room functions as they had done in Manitoba in the past. Adopting these different models of care used for many years in other Canadian jurisdictions help us get as much activity completed within our provincial system. Second, increase provincial capacity through more intensive healthcare purchasing efforts, our RFSA processes I referenced earlier. Third, engage the front line in finding solutions. We're doing this by including frontline healthcare professionals in our task force steering committee and by working with professional associations such as the Manitoba Physiotherapy Association to help ensure that our plans make sense on the front lines where care is provided. Fourth, use innovative solutions to solve these challenges. That has been instrumental in the selection of our chair, Dr. Peter McDonald, with his expertise and innovations honed over many years in his medical leadership role at Pan Am Clinic. With this long-standing focus on helping his patients return to living very active lives, Dr. McDonald will help shape this recovery plan in a way that is meaningful to all Manitobans who want to move forward from COVID, each patient in their own healthy and active way. Fifth, engage citizens and community in identifying challenges and finding solutions. This is why we have included citizens and patients on the steering committee and why we commit to transparent, regular reporting to our citizens on progress. The new Diagnostic and Surgical Recovery Task Force will lead this work. The Task Force Steering Committee and the project team will identify the most impactful strategies to make further strides in providing Manitobans with access to the safest and most timely care possible. I want to acknowledge the incredible members of the Task Force Committee who are agreeing to step forward and shepherd this recovery plan. Citizen participants, Sandra Sukan and Birgit Hartel. First Nations participant, Ms. Ardell Cochran, Executive Director of the First Nations Health and Secretariat of Manitoba. An individual named by the Manitoba Métis Federation, Julianne Sanguins, RN, PhD, Research Program Manager, Health and Wellness Department, Manitoba Métis Federation. Dr. Louis Oppenheimer, Patient Representative, who previously served as Medical Director, WRHA Surgery Program. Dr. Oppenheimer practiced trauma surgery and general surgery until 2008 and practiced critical care in the Surgical Intensive Care Unit at Health Sciences Centre here in Winnipeg, as well as advising governments throughout the years on wait times and patient access matters. Dr. David Hockman, General Surgeon, Frontline Physician, recommended by Doctors Manitoba. Dr. Pam Hebard, Oncological Surgeon, Frontline Physician, recommended again by Doctors Manitoba. Ms. Stephanie Betker, Registered Nurse, St. Boniface Hospital, recommended by the Association of Registered Nurses of Manitoba. Since 2007, co-chair of the Association of Registered Nurses of Manitoba, Emerging Leaders Network. The Emerging Leaders Network is a province-wide network created to provide space for students, new graduates, and early career nurses to connect and develop as leaders. Ms. Monica Malazewski-Layot, registered nurse at the Brandon Regional Health Centre on a surgical unit, primarily devoted to pre- and post-surgical care. Member of the Prairie Mountain Health Ethics Committee, recommended by the Association of Registered Nurses of Manitoba. And last, but certainly not least, 4 of our provincial clinical specialty leaders. Surgery, Dr. Ed Bushell. Anesthesia, Dr. Chris Christodoulou. Diagnostic Imaging, Dr. Marco Essig. Laboratory Medicine, Dr. Arnin Kabani. Each of these talented individuals is given of their time and energy to help build a better Manitoba for us all. Thank you, each and every one of you, for stepping forward. We know this work must be a top priority. In fact, the task force project leader has already begun, meeting with healthcare system leaders in Manitoba and looking at some of those short-term improvements that can be put in place as quickly as possible. But COVID is not done with us yet, so we need to develop plans and strategies for the medium and long term as well. We need to deal with the emerging challenges that are likely to unfold as we continue with the pandemic fight. And while we deal with the backlogs and wait lists that resulted from prioritizing COVID care and the pandemic response, we believe this approach will create benefits through the system as a whole. I want to be clear. The task force begins the work from a good place. It will build on the work that is already being done in Manitoba to address wait times and will grapple with the continued challenges on our healthcare system caused by COVID-19. The examples I raised earlier are just some of the examples of the work already underway. In Budget 2021, our government committed $50 million to address backlogs and wait times this year. This funding has been used to support $8.8 million in RFSA agreements with service providers to achieve thousands of procedures. This means cataract surgeries, echocardiograms, and other procedures that improve quality of life and care for people across the province. The task force will be accountable to Manitobans through public reporting. This will begin with a report in early 2022, with regular updates given to Manitobans through transparent public reporting. With that, I would like to thank you all for joining us today, and I'll pass it over to Dr. McDonald for his comments.
Thank you, Minister Gordon. Good afternoon, everybody. My name is Dr. Peter McDonald. I'm the chair of the steering committee that will provide direction to the Diagnostic and Surgical Recovery Task Force. I've been an orthopedic surgeon in this province for 30 years, and throughout my entire career, I've been involved in orthopedic senior leadership positions and administration. Since 2007, I've been University Head of Orthopedic Surgery and WRHA Regional Lead of Orthopedics. I'm a past president of the Canadian Orthopedic Association, and I'm president-elect of the American Shoulder and Elbow Surgeons. Manitobans care deeply about their healthcare system, the people who work in it, and how well it works for us. The healthcare system affects all of us, which means that any comprehensive look at the healthcare system must include many diverse perspectives. This is true of the Diagnostic and Surgical Recovery Task Force as well. Our role as the steering committee will be to be navigational leaders for the task force, and I will work closely with Matthew Lister to make sure this happens. The steering committee is meant to reflect our healthcare system with experts from many different areas and roles, while also providing the priorities of many people in the system must serve, including patients, citizens, and representatives from First Nations and Métis Nations. Diverse perspectives are needed to bring the best ideas forward. We need to have the right mix of system knowledge and those who are willing to challenge the ways that things have been done in the past. I have spoken with many of the steering committee members already, and I'll be speaking with the rest of you in the next few days. And already I can tell you about their commitment to change, to innovation, and finding solutions for Manitoba patients and families. I work firsthand in Manitoba's healthcare system. I know the strain the pandemic has placed on our healthcare workers our system as a whole, and that strain is still very real today. I see the strain that it puts on patients, including my own patients, on a daily basis. But there are solutions to be found, and Matthew has and will speak more about how the task force is harnessing the good work that's already been done in Manitoba to inform next steps for the short and long term. The strain of the COVID outbreak on the healthcare system is not unique to Manitoba. It is happening around the world. We cannot promise that we will deliver all the answers, but we can promise that we will work very hard and leave no stone unturned. This is a critical time in the history of our healthcare in our province, and we need to make sure that we get this right. I look forward to reporting back on our progress in the new year, which will set the stage based on what we know and what is to come. Thank you.
Thank you, Dr. McDonald. Your extensive experience is a vital asset to this task force. I'll now pass it over to Matthew Lister, Diagnostic and Surgical Recovery Task Force Project Team Director, for his comments. Matthew.
Thank you, Minister. Good afternoon. It's a pleasure to join you today at this announcement. Thank you, Minister Gordon, for introducing this task force and setting the context of its work. My name is Matthew Lister. I'm a senior healthcare leader who specializes in developing high-reliability health services and systems. Patients and their families need the diagnostic and surgical services they've been waiting for, and the task force is concerned for all Manitobans who now face these backlogs. We're looking at a broad range of solutions to help patients and their families, not only those expecting diagnostics and surgery, but also the related services that people need for their care and for their healing and recovery. With the oversight and guidance of the task force, we'll find and develop both immediate and longer-term solutions that will improve service accessibility and expedience. The public needs regular updates about service availability and backlogs. We will be setting up a public-facing website using the most current data available and showing performance in key areas, and we expect to launch this in the new year, and we'll provide regular updates and briefings to supplement the dashboard results. We started meeting clinical, administrative, and government leaders across Manitoba in October to gather their observations. We heard about the pandemic's changes to how Manitoba and all health systems prioritize and coordinate the resources. We also heard practical insights for improving care reliability and system performance. Minister Gordon has referred to several of these, and we know there are many other ideas out there amongst the frontline providers. You're an essential source of insight for service recovery, and we want to hear more from you. Every consultation we've had, and I've been on almost every one, has shown a willingness and an interest amongst the frontline leaders to get involved and become a contributor to recovering from the pandemic. We're developing an internal system to monitor proposals and to keep proponents apprised of where those proposals sit and their status. The system will be available in the new year as well for the clinical and service leaders. In the coming months, we'll continue building the project team, and we'll be joined by others with expertise in diagnostic and surgical services, acute and community care, mental health and addictions, analytics, modeling and evaluation, experiential design, and project management. I look forward to reporting back to you through our initial report in the new year. I thank Minister Gordon, Deputy Minister Hurd, Dr. McDonald, and Manitobans for the trust that you're placing in us.
Thank you, Matthew. We also look forward to hearing more about the hard work you and the team will be doing. I want to thank the people who will be part of this important work, including the task force, steering committee, and the entire healthcare team throughout our province. I know we have the right expertise assembled to make significant improvements in the timelines of care for Manitobans and ensure that we are positioned to deal with the challenges that could further emerge during this pandemic. Thank you all again for joining us today, and we'll now take any questions that you have. So we, of course, always want to provide care to Manitobans here in their province. We talk about providing care close to home, and that means here in Manitoba. So we will be looking across our system here in the province to determine whether the surgery can be done here. We have the capacity to do it here. And if not, then we would be engaged with the patient and their family about opportunities to have their care or their surgery provided outside of Manitoba. But first and foremost is to provide their care here in the province. Yes. And I have mentioned in previous pressers that we have a branch within the Department of Health and Seniors Care that works regularly with clinicians and healthcare professionals to determine whether their patient or client requires care outside of the province. And there's a process in place to assess that and to determine where they will be going for their surgery. And yes, we do cover the cost of that. Well, we have in the past, as I mentioned, we have a full branch in my department that has been working for many, many years with clinicians and healthcare professionals to assess whether care needs to be provided outside of the province. So it's not accurate to say that we're opening the door. That service has been available for many, many years. Possibly I'll let Ian Shaw share some additional data on that.
Good afternoon, everyone. My name is Ian Shaw. I'm the lead of the Provincial Health System Transformation. Minister Gordon's talking about the out-of-province program, and Manitoba, just like all jurisdictions in Canada, participates in a coordinated network of care where all the provinces coordinate services that they don't deliver in their home province. It's a normal part of care delivery in Manitoba. This morning, I pulled the statistics from 2007. On average, Manitoba has had 1,000 specialist referrals each year for that program, and about 97% of those specialist referrals were referred to services in Canada, with the balance in the United States or other international jurisdictions. The program works through the family physician to a specialist, and it really is designed to work where a specialist makes a referral to the program for complex services that cannot be provided in Manitoba, so that specialist consultations can be done. And then in cases where a person waiting for care in Manitoba has been waiting in a period of time that will impact their own safety or the outcomes going forward, Manitoba does pay the cost of the insured services in the other jurisdiction, and where the specialist requires a companion to travel with the patient, the costs of the travel for that patient are also covered. And the first priority in the program is always to deliver care in Canada, and then the closest international destination wherever that happens. There's a wide range of care services and procedures that are supported here. Some types of organ transplants, cancer treatment, CAR T cell therapy for cancer, some specialized addictions, eating disorders, things like post-traumatic stress disorder, support for patients who have implants or pacemakers that have infections, things like that. I'm going to turn over to Dr. Bushell to talk about the process for referrals with the specialists.
Hi, my name is Ed Bushell. I'm the head of surgery for Shared Health. We have every intention of delivering all the care we possibly can here, but we will not jeopardize the health of any of our patients as we do right now. We have a series of evaluations that happen for each one of our patients that need to be transferred out of province. We will continue with that. No one will be denied care if they're going to have irreparable harm or happen to them because of surgery not being delivered. But our first and foremost attention will be to develop the best system and the best care we can here. We have great surgery here. We deliver surgery to many people from many other provinces in our province. That's part of the reciprocal arrangement. We don't anticipate changing our plan or our process for shipping people to other provinces or out of country. It's based on a need that would otherwise not be met in a timely fashion in our province. So our process will remain the same. We don't anticipate significant changes in it. Thanks.
Dr. Buchel.
Yeah, in the short, so it's very hard to predict what's going to happen on the next wave of COVID and the wave after that and the wave after that. As been said, we're going to live with COVID for many months to many years. At the present time, we don't anticipate a significant increase in the numbers of surgeries leaving our province. We are trying very hard not to see neurosurgical cases, cardiac surgery cases go out of province, and managing our ICU bed base to make sure that that doesn't happen right now. Might that happen? It might, but at the present time, we're not expecting an increase of what we normally transfer out of the province because of skill sets that we don't have. Skill sets that we have in the province with our nurses, with our surgeons, should be able to maintain our current care volumes. For the surgical cases alone, not procedures, not diagnostic imaging, we estimate somewhere around 25, maybe as much as 30,000 people. Part of our dilemma is we don't have exact data from a surgical waitlist information system, which is one of the main things that is moving forward and that is put forward and been highlighted in this COVID pandemic, that we really need to do this, and this is moving forward now in a very expedited process. I think I'll let
Matthew.
Can't, at this point, speak to a specific timeline. We're still gathering a lot of information from our frontline staff and from different units. We do know, and what I would like to speak to is that there is a consistent interest and effort across all frontline staff to participate in a solution and to find a way of clearing those backlogs. So we anticipate a lot more ideas coming into play, both in the short and the longer term. I think we'll be able to provide more information about that in the new year. I would say no option is off the table right now. We are studying every possible option.
Can we just finish up this line of questioning, Dr. Buchel, please?
That is our primary focus. We know our nurses have been overwhelmed. We know that the amount of hours that they've been putting in, our staff in our operating rooms have been reassigned and redeployed to keep Manitobans alive. We need to support those nurses with more staff, with all of the support for our RNs, and that will mean hiring LPNs. As Minister Gordon said, we are hiring LPNs into our operating rooms to deliver care by them that is most appropriately delivered by them, as in other provinces. We will be looking at any alternate care pathway that we possibly can. As Dr. McDonald said, every stone will be turned over to look for every path forward to make sure that no Manitoban doesn't get the care that they deserve from the surgery program.
So we have already begun opening those seats, 400 in total over the next couple of years. So we've had to give those facilities and academic institutions time to scale up. But we have already begun opening several hundred seats. And as you know, the Bachelor of Nursing program requires 4 years of study, so we are doing that on an incremental basis, but several hundred have been opened across the province. Yes. Those are permanent seats at the University College of the North. Yeah, excellent program.
At the present time, we have no plans to start sending routine cases that are on a backlog or a wait list out of province. We had wait list patients before COVID started. We have backlog cases now. Provided everybody can get care in a timely fashion and it doesn't lead to permanent harm, then we will continue to strive every day to increase our capacity so we keep Manitobans in Manitoba with care delivered by our surgeons and our nurses and our hospital system. If there's going to be problems with their health care long term, we absolutely will transfer them out to make sure that they have the care that they need in a timely fashion. Yeah, so we do in the surgery program look through our wait list all the time. We talk with our surgeons all the time. We triage patients every day. That's part of a wait list. The backlog added to that wait list. We will make sure that because of the people on that wait list, if people, quote, time out or have waited too long, that they will now be in jeopardy of having permanent damage. Absolutely. We will evaluate everybody that is on a wait list all the time, over and over again. The backlog hasn't changed that process. It's increased that process. And it's important to realize and for our province to know and our people and our patients to know that we look at those and we will continue to look at people on wait lists and on backlog and make sure that they get the care in a safe and timely fashion. We're not changing the process. We've added the number of people to that process. We've heightened the acuity of the surgeons and our staff and the system to make sure that people are not being hurt because of this wait list. We're not changing the process.
So there are many things at play at any given time in the health system, and regardless of how difficult it's been throughout the pandemic period, we have to continue to provide non-COVID care as well. So our goal is not to cancel surgeries. Our goal is to look at solutions that will allow for Manitobans to continue to receive their surgeries. At the same time, we recognize that there's challenges with staffing, and that is why, as I was asked earlier, we've added 400 new education seats. I have 40 nurses that have recently graduated from the critical care nursing programs. We are ensuring that our new graduates will hit the ground running after they finish their 4-year program by establishing the new undergraduate nurse education program for our 3rd and 4th year students. Our internationally educated nursing program as well will bring new nurses to our system. So we have to continue, Ian, to do the right thing for Manitobans, to ensure they receive their surgeries, that non-COVID care is not jeopardized throughout this period. As I mentioned in my notes, cancer care services were preserved throughout the pandemic, and we will continue to do our very best. As Dr. McDonald said, no stone will be left unturned to ensure that we are providing Manitobans with the care they need right here at home. So our goal is not to cancel surgeries. I'm going to, Dr. Buchel and I had a really good conversation in my office before we came down. That is not our goal. But we recognize that from time to time there will be situations where maybe due to staffing we may have to postpone a surgery. And we will always ensure that those are not urgent surgeries and that individual's care, as Dr. Buchel mentioned, their health will not be harmed by the postponement of that surgery. If you'd like to add further, Doctor, please do so. But that is not our goal. It's not to cancel surgeries. We have great physicians and surgeons here in our province, and nurses and allied health staff, and we want to work collaboratively with them to ensure that they are able to provide those critical services in surgery, in ICU, in medicine, and at lower acuity beds and hospitals throughout our province. Go ahead, please.
So in terms of canceling surgery, we are not running at full capacity right now. That's well known. We are not planning on reducing surgical capacity down any further than it currently is. We will optimize what we can right now based on our staffing, based on our system resources, based on how many people are in the hospital with COVID and are in the ICUs. That may mean we augment some of our sites that are outside of the city. That may mean we continue to augment our RFSA program to deal with patients where we can. But we have no plan right now on the table to further reduce surgery than what it is. In fact, the exact opposite is true. We are planning very diligently to increase surgery in the new year and hopefully go back to full capacity within a few weeks of the start of the of next year. Thanks.
Yes. Well, our government has made this a priority. The Premier said this in her swearing-in speech, her many times in the chamber, that this is #1 priority as we move through the fourth wave. And so we've dedicated $50 million, Danielle, and if it requires more funding, we are open as a government to doing that, to providing the funds to make sure this backlog is cleared and the wait lists are reduced and Manitobans receive the surgery and diagnostic care that they need. Well, we are going to be gathering all the information around the wait list, the types of surgery, the low acuity, the high acuity. We have to look at each client on that list to see what their current state of their health system, their health is, and then determine how we then begin to work with service providers. I've received so many proposals on my desk. I'm excited to see that so many providers want to step forward and work with us to assist with clearing the backlog and the wait list. So once we have that information available, we'll be able to give a better idea of the movement of the task force and how quickly we will be able to clear the backlog. Ian Shaw.
Hi, Ian Shaw. Thank you for your question. So I think you're talking about the request for a supply arrangement process. That's a process that brings together what we call commissioning resources in the department, folks that help determine what services the government wants to purchase and align with care. There's two parts to commissioning, figuring out what things that you do within the health system, and then one part that's dealing with what we call alternate service providers. So that group, together with folks from procurement and central services in the government, and then some clinical advisors, actually prioritize the work. They work with Dr. Buchel's team, the other provincial specialty leads, to identify places where there's a requirement for extra capacity. They issue an RFP, or a request for services, and on the basis of that, the submissions come in and the evaluation team makes a detailed selection and evaluation. In the context of the package that's there, you'll see details from 2021 and this current year. These resulted in multiple awards, some to alternate service providers and also to our providers in the health system. So for example, the work on echocardiography that the minister was talking about was work that was delivered by our health system, not by alternate service providers. The kinds of organizations that provided work in 2021 and this year are Western Surgery Center, Vision Group, Pan Am Clinic, Maple Surgical Center. We had services also provided by Health Sciences Center, and depending on what requirements are issued, there's opportunities for different organizations to provide responses. I think Matthew talked that there will be a contact place for people that have provider options to be identified. That work will be connected with future requests for services and supply arrangements, and that process will continue to evolve as the task force makes recommendations on priorities. The services that we talked about in 2021 and this current year, the 9,000 procedures this year, are already happening. So I'll turn that over to Matthew or Dr. McDonald. The idea will be that they're going to identify additional priorities working with the teams into the new year, and then that will cause additional RFSA processes or other discussions with providers in the system.
So I'll turn it over to Dr. McDonald for comments.
Thank you. As far as your question goes, I think we want to identify different options in the system to do above and beyond what we've been doing so far. I think it's our mandate to get a broad representation from our committee to get ideas as to what, in addition to what already has been done, what else can we do to try and solve some of these problems. So we're open to suggestions. We're open to suggestions from the general public. We're open to suggestions from the broad representation in our committee to come up with different ideas.
Dr. Bushell.
Sure, because we don't have absolute numbers, and you can choose to be on one end and the other end. There's been estimates right across Canada in every province that are 1 or 2 times higher than another person's estimate. In our province, it is very simple. In 2019, we did X. In 2020, we did X minus X number of procedures based on 2019 data. That's what we can honestly tell you is our best guesstimate of the people waiting. We know who acutely is on the list for tomorrow, the next day, maybe up to the next month. But after that, we don't have a good information management system to know who is waiting to be seen in the clinic, who is waiting for their test, who is waiting to be scheduled. We can tell you very accurately our cancer cases, our cancer processes, and the disease process that's happened is very accurately followed because we have pathology reports from everybody. And we know that we are not changing the stage of the cancer nor the time to treatment of those cancers in our province. I can also tell you there are more hips and knees on the wait list than there was in 2019. Those are broad strokes that we can give you. You can choose to choose one end of those or the other end. But what we can tell you is in 2019, here were the major surgical cases delivered. In 2020, there was less. In 2021, there was less. That's it. The number that Doctors Manitoba is giving, they have asked us if we feel that is correct. We have been very clear with them. I have no way to discount their number, nor do they have any way to challenge our numbers. We're very transparent. We know there's patients on the list. Whether it's 1 patient or 25,000 patients, they need to be treated. That's why we're doing this.
Yeah, as you know, some of these things are complicated and it's hard to switch on overnight, especially when it comes to human resources and staffing. So that our goal is to get ready now so that when we're in that position, we are ready to go and we're ready to increase above baseline. And we're already doing some of those things in the past couple of years, but we need to extend beyond that, obviously, to make up some of the backlog that we've experienced recently.
This is for sure incremental improvement that's going to be happening. We haven't sat around for 2 years thinking, oh my goodness, let's wait till we completely crash. We have an information management system because that was a huge problem. That has gone through one of the most rapid RFP processes to get data so we can address what the real number is and we know who's on the wait list and we can monitor what we're going to do. That process is going to happen. It is happening now. We have started to hire more staff into our operating rooms. We have done alternate levels of care and modified levels of care on our wards in our most acute hospitals. We're using physiotherapists to help us with our nursing staff on our floors. Those are happening now. What they're doing right now is preventing a further drop in our acute care services. But they're there. They're being established. We have nurses being hired. We have LPNs being hired. We're using physiotherapists in new and alternate ways of caring. We're developing an information management system, and we delivered huge amounts of care doing an RFS because of the RFSA processes. All these things are building. They're stopping us from falling, but they're building. And as we stop falling, they're there, they'll be implemented and incorporated into our task force. So this is not the start point of the work that's been done. This is a consolidation so that we can get more support from our government, from experts that help us coordinate the care that we're desperately trying to give. But we have processes in place and have been delivering care above and beyond what we normally would have done in 2019 and 2018. There's no question. We have worked very, very hard to deliver the COVID care. Our nurses will tell you point blank, they're working harder, they're more stressed, and they're tired of this. We know that. We will hire more nurses. We will train more nurses. We will train LPNs. We will train alternate care providers. We will deliver staff. We will deliver space so that we can deliver surgery in our province. All those things have to happen simultaneously. No one can deny that we need more staff, but we need staff that's outside of the status quo. We have done the status quo. It won't work in our current situation. We need to think outside the box. This task force will think outside the box.
How much longer will this backlog run? How it's continuing to grow as well as that?
Yeah, I wish I had a crystal ball. I would tell you the task force or the backlog will stop growing once we stop having 200 patients a day with COVID, once we stop admitting people to the ICU, once we stop having a 30-bed unit at St. Boniface Hospital full of COVID-positive patients. We need to care for all the people in Manitoba. We're developing capacity to treat that added burden and still deliver care from a surgical standpoint simultaneously. So I'm hoping that we go to baseline for sure within a couple months into the new year. That's the goal. That's the goal.
Considering that much has been reported, why don't we implement more stricter COVID restrictions so we can free up ICU beds?
Well, we're continuing to encourage all Manitobans. As you know, we've got 87% of Manitobans double vaccinated, and I thank each and every one of those individuals that rolled up their sleeves not once but twice to get vaccinated. Many of those individuals have now received dose 3. We recently made available the vaccine, Pfizer vaccine for 5 to 11-year-olds. We've brought in more restrictions around 12 to 17-year-olds playing indoor sports. We have some of the strictest provincial health orders across the country. I just looked at a jurisdictional scan, and we were either in line with other jurisdictions or our restrictions were greater than other jurisdictions. So we're continuing to work with public health experts and officials to monitor the numbers. We do see them creeping up, and so we're paying very, very close attention. We all missed the holidays last year and Christmas with our families. We don't want that to happen again. So we are in discussions about the numbers, and if need be, we will be tightening those restrictions. So we are monitoring them very, very closely.